it's been depressing. It's been crushing. Reading our response and comparing it to other countries is it's morbid. It's morbid. Hello, I'm Stephen Miller. I live in Washington, D.C. I'm 33 years old. I live with my wife and 18-month-year-old. Living in DC, our parents don't live close by. My parents live up in New York City. Her parents live in Denver. And the typical day was drop Arcadia off when daycare opens up at 7:15, and then I was picking her up when I'm getting back from work from Baltimore City at 6:15. So that was 11 hours of childcare that we had per day during the weekdays. That was just gone. Now, of course, my commute has disappeared. I was commuting an hour and a half each way to Baltimore City. That's no longer the case. So I gained back some time that way. So having no childcare has been pretty problematic. Now, our respective works, I work for the state of Maryland and my wife works for a healthcare non-for-profit. They have been understanding about the situation and have been understanding about there's no way we could be putting in 40-hour weeks. But that said, we've gotten no help with childcare. We've just been taking care of our child for 100+ days at this point, no stop, with a full-time job, no vacations, not going out, not going to bars, not going to restaurants, nothing like that. Our routine has changed drastically, and I think we were able to cope pretty well in the early going, but um, it just finally sort of weighed on me. Got tired. Arcadia is 18 months old. She was born January 4th, 2019. So she was just over a year old when the pandemic really began. And I think this is a discussion that's happening in the United States a lot, is the fact that we don't have a good safety net at all for people with children. And we were wholly unprepared to deal with the coronavirus, period. But we have not had any sort of conversations about what work looks like if you don't have childcare. The conversations have constantly been about when can you go back to work? When is the easiest time that you can get back to work and start doing things? My wife and I are the typical, we both want to work. We are both driven people. We both want to get, do things that we love to do and to be involved in the workforce. And neither of us really contemplated the idea of parenting, of being a full-time parent. Um, Not only because of cost, we couldn't live in DC with one person being a full-time parent and the other person having a full-time job, but we really didn't contemplate it. And I think an interesting thing that's come from this pandemic is that it's really given us a taste of full-time parenting and what's involved in that. And it's been fabulous in a lot of ways. We've seen Arcadia be able to grow a lot in the last, oh my goodness, 4 months. Yeah, 4+ months. And so that's been really exciting in some ways to see her learn language, be able to ride on my bike, to walk very confidently, to get into a lot of a lot of boo-boos. I think the one thing that has been weighing on us a lot is that she was a social child at daycare, and that's just been taken away. She doesn't get to see other children very often. Up until about a month ago, she was only seeing children through Zoom and children on the sidewalk. We would walk on the sidewalks, and she now points and says, "Baby, baby." But about a month ago, we've started, I think, what some Americans have been calling their pods. We sort of have a pod going with another parent that we know who lives in the neighborhood, and so they've had a couple of play dates in the last month. And they and the other parents are very good about not. They've been very, very good themselves about not going on about, just like us. So in some ways, we've been able to cross that line without feeling too bad, but we feel guilty still. about meeting in person. It just, I think it's where we're at as a society that we need to do good work because so many people aren't doing good work. So many people are fudging it. They're drinking at bars, they're sitting outside within 6 feet of each other. And it doesn't look like Americans are up to the task of actually making the sacrifices necessary to get this managed. And so, to some degree, I think my wife and I have seen it as a sacrifice that we're trying to make on behalf of others that can't, um, but frankly, also to offset a bunch of people who refuse to make this sacrifice. We live in the basement of a townhome. It's maybe 715 square feet. We have, air quotes, 2 bedrooms. One is for ourselves. One windowless room is for our baby, our child. And then we have a living room with a desk at it. And so fortunately, I have a desktop. We have a monitor. My wife has her work actually provided her a laptop. Her work was already transitioning to a partial telework arrangement. And so going into the coronavirus, her setup was already pretty good because she had a work laptop. She had been teleworking 1 day a week. My work was not working for the state of Maryland. The day that I had to sign the telework agreement, that everyone at work had to sign telework agreements, it was a cluster. That said, I'll give them credit. They were able to turn it around. Within 1 week, everything was set up and everything was good. Our arrangement is somewhat interesting because obviously sharing childcare duties. I've talked to other people who have young children as well, and sometimes it's like a half a day on, half a day off. Like you're in charge of the kid in the morning, then you can work in the afternoon, and vice versa for the parents. Um, for us, given how many meetings my wife has where she has to be there in person, we trade off basically every 2 hours. And so we have to come up with a regimented schedule every single day where, I have a meeting at 9 and she has to be on childcare. We're not quite the parents that want to slap her in front of a TV and have her watch Sesame Street for 5 hours on end. We want to try and be there and active in her life. If we cannot figure out a solution to providing childcare, you're going to continue having 40% of the working population unable to do their jobs to the level in which before the pandemic, which is fine if you accept the loss in productivity. But many of our workplaces don't want to accept that loss in productivity. We don't have worker protections. Unions were trending downwards for the last 50 years. We don't have the same level of not only job benefits and pay that we used to have as a nation, but we are not protected from a work forcing an employee to come in dangerous situations. Something that we're having to reckon with for the first time in a while is that we have unsafe working conditions. And the federal government right now is unwilling to step in and is actively writing legislation to protect businesses versus employees. If you work for the government, you have a strong union. If you work as a teacher, you have a strong union. I am a regional planner, so I actually work for the highway subset of our transportation department to try to get us into agreements about what we want the state of Maryland to look like, what elected officials are pushing for to make sure that we know what people want their transportation networks to look like, to advertise to people what projects we're doing for them, going to community organizations, community meetings, talking about our transportation network. Really, North American cities were built to allow as many people in cars to enter their city centers as humanly possible. And I think they've realized with the lockdowns that, we don't have nearly as much traffic anymore. There's no more traffic in our city centers because people aren't coming to our downtowns to commute anymore. They're teleworking. What mayors of cities are realizing is that, oh yeah, we don't have to mayor for all the suburbs. We need to mayor for the people within our jurisdiction. And I think that we're getting a lot more emphasis on walkable, bikeable infrastructure. And And especially because so little of our physical space has been provided to pedestrians and cyclists. When you have, I need 6 feet between myself and another pedestrian, the geometric problems that you run into on a 5 foot sidewalk simply mean you can't pass close enough by or in a safe enough distance away from each other. So I think in cities, you're going to get a lot more mayors focused on active transportation. Transit is in really dire straits in the United States. New York City is $18 billion in debt, or has an $18 billion deficit going into this next year. While other forms of transportation are starting to rebound in the United States, transit is not. People are scared of it, and that is to some degree a problem with our elected officials. It's also just continued bias by Americans that transit is dirty and it spreads germs. But frankly, the media does not adequately um, alleviate those fears. It thinks of transit as only 1% of the population uses it. So why should I try and dispel fears that it doesn't spread virus? That studies that have been done about transit show that in fact, there is no correlation between high capacity transit, such as the underground or the New York City subway, and the spread of the virus. But Americans were distrustful for transit prior to this, and they've left in droves. One thing that hasn't changed was grocery shopping. I was shopping once a week for groceries, bringing them home on my bike. I think the only difference is whether I was wearing a mask now versus before. We used to like going out to restaurants before we had a child, and even after we had a child, we liked walking places and picking up food from other places. Now, that actually hasn't changed too much because places have allowed for delivery, allowed for on site pickup. So we've been able to support our local businesses that way. We like to try and be out and about as much as possible because we do live underground fundamentally. So being out and about, even if we're not being social with people, it just meant that we were not being stuck in our tiny basement level unit. We used to have a standing date with our friends on Saturdays, coffee club. We would go to a new coffee place every week. That's of course nixed. But we substituted that coffee club with Zoom. So we'd all hop on Zoom with cups of coffee and start talking. As far as positive changes, I've started exercising a lot more. I bike. I've loved biking all of my life, but now I am trying to get out biking close to once every 2 days, even when it reaches 100-degree temperatures. Like trying to get out at 7 in the morning, 6 in the morning, just to get some level of exercise. The built environment has changed. I mean, corridors that used to be really busy and happening and people were interacting are now just dead. In the United States, it really depends on the state and the city that you occupy. DC, because of its unique status, the mayor's office has issued rules. And so restaurants are allowed to open, but they're limited capacity. They're, they've been able to do outdoor dining for the last couple of months at this point. But again, you have to maintain distance. Recently, just a week ago, she issued a face mask order where if you are outside, you have to have a face mask. It used to be where if you were indoors, you had to have a face mask. There are fines and penalties. I actually just read an article about how restaurants in DC are starting to get fined for not following the rules. $1,000 fines for serving patrons too late, for not providing food with liquor, try and ensure that people aren't lingering too long. DC and the East Coast has taken this seriously from the get-go. California and the West Coast has taken it seriously. But in the end of the day, what New York State does differs from what Texas does, which differs from what Florida does, which differs than what California does. And there's really not much the federal government could have done to have changed what each of the state leaders and even individual cities could do to the response. In this federated system, yes, we're doing better, but I also know that if someone went to Texas, they can bring it back with them. And there's nothing we can do to prevent someone from Texas from coming to DC or going back to New York City or or anything like that. I believe that if we had a different leader than Donald Trump, it is possible that we could have dealt with this in May. But in the end of the day, what New York State does differs from what Texas does, which differs from what Florida does, which what differs than what California does. And there's really not much the federal government could have done to have changed what each of the state leaders and even individual cities could do to the response. Now, I believe that Donald Trump set the Overton window, that he set this set of outcomes that were uniquely bad, that uniquely made sure that we could not deal with this responsibly. It is up to the United States president to try and unite the country. And we have had a very disunited take on the virus. When New York City and New York State were shutting down and trying to stop the spread, Texas was opening up. And it ensured that in the United States, where we have the freedom of movement, that we would never get this virus under control. And it's showing. It's showing in July. We read stories of all the time, hospitals that are filling back up, that they're at capacity. I have stories. I grew up in New York City. I still have a lot of friends in New York City where, their parents died, where their family members died and they couldn't see them last 3 days of their life because they could not get close to them, given the precautions. Convention centers being used as makeshift hospitals. The United States has been focusing on healthcare for a very long time now. It is a very balkanized system that doesn't provide good care to the vast majority of its citizens. We provide very good care for people who have good coverage. We have some of the best doctors and hospitals and equipment and pharmaceuticals, and providing those services at a cheap cost, at a cost that's sustainable. It's something that we were grappling with before the pandemic, and during this pandemic, it's been readily apparent just how disorganized it all is, how patchwork it is. We patched a hole in our leaky healthcare ship in 2009, 2010, whenever the Affordable Care Act was signed. But we're still not there. We didn't have enough protective equipment for our healthcare workers. We didn't know where the virus was. We don't have anything to really measure the magnitude and to ensure that our healthcare workers don't have to work 24-hour shifts. I have to recognize where I sit on the spectrum, where I sit as a progressive. I think that if we had socialized medicine, I think we could have handled this much better. That said, of course, I have read stories about NHS and the issues that they've been running into. I mean, it's the same issues of not enough protective gear, 24-hour shifts, hospitals that were filling up. Given the dogmatic language that Donald Trump has used, his disdain for government employees, I think if we had socialized medicine, I think they're still getting thrown under the bus. But on the other side of the spectrum, if we had a sensible safety net in terms of workers' rights and childcare and everything that goes into the society, we wouldn't be feeling as anxious as we are. We wouldn't be trying to bully our teachers into coming in August to take care of our children. If we had paid unemployment in a sensible fashion, if it wasn't so balkanized, where Florida has a different system than New York, and there are these famous examples where people are still waiting for unemployment paychecks in Florida. There was no quick way to give people money because of our disdain for the poor, for our disdain for what are dubbed government handouts, and really the lack of a federal response. We can handle the immediate medical issues. We are not handling the societal stuff. It's been depressing. It's been crushing. Reading our response and comparing it to other countries it's morbid. Within my cohort, progressive Americans, we like to compare ourselves internationally a lot. And so, I get news about how was Italy dealing with it when they were going through it? How was Spain? Why is Sweden so different from the other Nordic countries and their response? So I think in my cohort, we were very informed about what was going on internationally. I get a window into other countries through the BBC, through the lens of the BBC. I also am a subscriber to The Economist. I've sometimes read the articles that people post on Facebook about other countries. I started consuming several different media outlets and trying to get the latest information, not in a productive way, in a purely morbid way. This is why I hold my beliefs, and this is why I'm part of this tribe, and this is why I hate this other tribe. It didn't change my behavior. It just made me sad. The United States has always been behind the ball on mental health and how it affects society. Many times insurance doesn't cover mental health. A lot of Americans are very tired. We don't get as many vacation days, period. Again, our childcare was never solved. Many parents are still looking after their kids. Some people who kept their jobs felt like they were being forced into servitude because they had people they knew doing exactly the same work, being told not to work, and were being paid more money to not do that. I didn't lose my job. I haven't had to take a pay cut. I'm doing fine. Millionaires and billionaires are doing fine. The American working class was underwater going into this, and the only reason why their head is above water is because Americans put aside their petty differences and started just giving people money. It is not me before the society. It is not me before the community. We all have to pitch in and do this together. And fundamentally, as Americans, we're fucking selfish. I mean, I'm out of words for it. I'm out of superlatives. We're selfish. We are a selfish people. It is we get what we want when we can, and get out as soon as you've got it. The United States right now is a casino, and some people are just they're making a lot of money off of a pandemic. I mean, Jeff Bezos has, I think, he's increased at least double digits in his percentage of wealth. I find myself very fortunate. As a public employee, I have good union protection. I have good benefits. My boss is understanding of my situation. We are the minority, I feel, in the United States. A lot of people have lost their paychecks. A lot of people have lost their jobs. A lot of people can't pay rent anymore. A lot of people, it's our mental anguish relative to society as a whole, not only within the United States but the world, is minimal. I still feel thankful for where we are at as our family unit.